Knock, 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 knock.
Hi.
Hi, I'm Bella and I'm going to be your student nurse today. Today we're going to be doing your head to toe assessment. So before I begin, I just need to verify your name and date of birth, so if you can just tell me that.
Sarah Rusher, April 20th, 1994.
Right, perfect. So let me just look at your armband. I have Sarah Rusher, April 20th, 1994. Perfect. And then, so do you have any allergies to latex or any medications?
No.
Right, perfect. So I'm going to close the curtain to provide privacy, and then I'm going to do my hand hygiene. So before I begin, I need to know, do you have any cultural considerations that would keep you from completing this assessment?
No.
Right, perfect. And then, do you have to use the restroom before we begin, because this assessment takes about 20 to 25 minutes?
No.
No? Right, perfect. So I already asked you what your name and date of birth is, so I just need to know, do you know where you are right now?
Galen Hospital.
And then do you know what the date is?
September 7th, 2020.
Right, perfect. And then I need to ask you about your pain. So I need you to rate your pain on a scale of 0 to 10, with 0 being the no pain and 10 being the highest amount of pain.
0.
Right, perfect. And then so the patient is cool, cooperative, well dressed. She's alert and oriented by 4. So now I am going to don on some gloves, and the assessment is about to begin. So if you could just sit up in bed for me, and I am going to need to, I'm going to assess your hair and your scalp for any infestations, any redness, swelling, any bruising, and let me know if anything hurts or if you feel any tenderness, okay?
Mm.
So everything looks normal. I don't see any infestations or anything. So that's great. I'm going to doff these gloves. And now I'm going to begin by, and then if you can just sit up and turn towards me. Perfect. So I'm going to assess your sinuses. So I'm going to start with your frontal sinus. And then I'm going to assess your maxillary sinuses. And did that feel tender or was it painful?
Nope.
Right, perfect. So now I'm going to assess your nose, and I'm going to look at your nasal cavities. So I don't see any redness, swelling, or any sores. Perfect, so that looks normal, and it's red, it doesn't look dry in there. And now I'm going to have you open up your mouth and say ah. Alright, perfect. And you don't, and everything is red, it looks moist in there, and your uvula is centered, and your lips are dry. I mean, they're not dry, they're red and they're moist. And I forgot to add that usually you would ask an older client, or just like a regular client, if they have any dentures, and she did not. So now I am going to assess the ears, and let me know if anything's painful, okay?
Mm.
The other side. So you didn't feel any tenderness, correct?
Correct.
Alright, perfect. So now, usually, if you would have an otoscope, you would pull the ear back and to the right, and you would inspect for any extra cerumen inside and for inner ear structures, and you do the same on the other side. So now I am going to inspect to see, okay, so her eyebrows and her eyelashes are intact. Let me just look to make sure that the conjunctiva and the sclera are correct color. Alright, so I see red and pink, perfect, that's normal. And now I'm going to test for your visual acuity, so if you can just sit back. So what I'm going to have you do is I'm going to have you read the letters off the chart, and I'm going to have you cover your left eye first and then read with your right eye. So if you can do that.
TCBAN.
Alright, perfect. And do the other eye.
TCBAN.
Alright, perfect. So now what I'm going to do is I'm going to test your pupil strength. So I'm going to test for accommodation in your 6 cardinal fields of gaze. So I'm going to turn off the lights. And then if you can just sit up towards me, like you did before, and I'm going to have you look over this shoulder. Right. Right, perfect. So the pupils are round, and they react well to light. So now I'm going to turn back on the lights, and I'm going to test for the patient's visual accommodation. So I'm going to have you look at the tip of the pen, and then I'm just going to bring it in and just stare at it. Right, perfect. Her eyes are accommodating well. And now I'm going to test your 6 cardinal fields of gaze. So what I'm going to have you do is I'm going to have you stare at the tip of the pen again. I'm just going to have you follow it with your eyes, okay? So we're going to go up, down, side to side, up, down, up, down. All right, perfect. So everything's perfect. The head is the correct size. All of her structures are even on her face. Everything is centered correctly. So now I'm going to inspect the patient's lymph nodes. So I'm going to start with the preauricular, the postauricular, the occipital, the submental. I'm gonna do, that wasn't correct. Let me self-correct. I'm going to inspect the jugular digastric, the submentals right here, the submandibular, and the midclavicular, which are right here. And then I'm going to do the deep cervical, the superficial cervical, the posterior cervical lymph nodes. And then did you feel any tenderness or any pain?
No.
Right, perfect. And then now I'm going to assess your axillary lymph nodes. So right here, right here, right here, and right here. Did that feel painful?
No.
Right, and now I'm going to assess your epitrochlear lymph nodes. And did that feel painful?
No.
Right, perfect. Alright, so now I'm going to assess for your jugular venous system. So if you can just move your hip this way. Right, perfect. So this side looks normal, and while you're over here, I'm going to assess your carotid artery pulse. Right, usually I would do it for a minute, but I'm only doing it for 30 seconds. And it's 70, so that's normal. Let me just do this side just to see. So you don't have any jugular veins on this side that are distended. And let me test your carotid artery on this side. Alright, and that's 72. So now what I'm going to do is I am going to put my hands on your shoulders, and I'm going to have you lift your arms against resistance. Alright, perfect. There's no crepitus noted. So now I am going to assess your respirations. Usually I would also do this for a full minute, but due to the time constraints of the CPE, I'm only going to do it for 30 seconds, so breathe normally. So the patient's respirations is 16. And like I said, usually I would do this in real life for a full minute, but due to the CPA, I'm only doing it for 30 seconds. So now I'm going to assess that the patient's trachea is in the correct position. So, and I'm going to make sure that the substernal notch is in the correct area, the angle of Louis, and the costal angle is as well. So the trachea is in the correct area, the substernal notch is in the correct area, the angle of Louis is the correct area, and then the costal angle is in the correct area, and it's at 90 degrees. Perfect. So now I'm going to assess the patient's anterior lung sounds. So I'm going to start with tracheal, vesicular, tracheal, bronchial, bronchovesicular, and then vesicular, Alright, perfect. So now if you can just turn to the posterior side so I can assess your posterior lung sounds. Then here, let me just move your hair for you.
Sorry.
No, you're good. So I have bronchovesicular. Then I have vesicular. And now I'm going to assess your tactile fremitus. So what I'm going to have you do for this is I'm going to palpate your back to test for any vibrations. I'm just going to have you say 1, 2, 3, okay?
99.
Oh my god.
It's okay.
I'm going to edit that out.
Yep.
Okay, so I'm going to assess your tactile fremitus, and I'm going to have you say 99. And I'm going to test for vibrations, okay?
99, 99, 99, 99, 99, 99.
Alright, perfect. So now I'm going to assess for bronchophy, and with this, I'm going to have the patient say 99 as well in your spot.
99,
Okay.
99,
Uh-huh.
99,
Uh-huh.
99,
Uh-huh.
99,
Uh-huh.
99.
Alright, perfect. So now I'm going to test for egophony, and instead of saying 99, the patient's going to say E, okay?
Mm-hmm. E, E,
Uh-huh.
E,
Uh-huh.
E,
Uh-huh.
E,
Uh-huh.
E.
Alright, perfect. So everything sounds normal, and then the last thing I'm going to do is I'm going to do the whispered pectoral test. So I'm going to have patients say 1, 2, 3, but they're going to have to whisper it, okay?
Mm-hmm. 1, 2, 3.
Okay?
1, 2, 3.
Uh-huh.
1, 2, 3.
Uh-huh.
1, 2, 3.
Uh-huh.
1, 2, 3.
Uh-huh.
1, 2, 3.
Alright, perfect. So now I'm going to assess the patient's heart sounds. So for this, I'm going to start at the aortic region, and that's the only one that's on the right side of the sternal border, and it's in the second interspace. So alright, perfect. And now I'm going to do the pulmonic, and this is in the left sternal border, second interspace. Alright, perfect. And now I'm going to do Erb's point, and this is in the left sternal border, third region. And then now I'm going to do PE. And then now I'm going to do the tricuspid, and that is in the fourth, it's in the left sternal border, fourth region. Alright, perfect. And then now I'm going to do the mitral, and this is in the mid-clavicular area, fifth intercostal space. Alright, perfect. So that sounds normal. Now I'm going to assess for murmurs using, instead of the diaphragm, the bell of my stethoscope. And I'm going to, usually you would do it in all 5 areas, but instead I'm just going to do it in the mitral area. Alright, perfect. So no murmurs are noted, and I hear normal S1, S2 sounds. So now what I'm going to do is I'm going to assess the apical pulse, and I am going to, so hold up that side, yeah, perfect, and then I'm going to also assess the radial pulse to check for any pulse deficits. So I'm going to start now, and it's usually for a minute, but due to time constraints, I'm only going to do it for 30 seconds, okay? Alright, perfect. So the patient's pulse in the radial and the apical pulse is 70, so that's normal. And